Thank you for doing this with us today. I just want to know, we are now transforming from an orange zone to a red zone, Montreal and Quebec City. What does that all mean, and why might this be alarming for some, and is it alarming for you?
I don't know if that it's alarming is the right word. I think it's certainly expected to a certain degree. We've been seeing the cases going up, and the government was going to have to impose some tighter restrictions if we're going to control this pandemic and prevent a wider spread. So I'm not entirely surprised this has happened. I'm sure it's concerning for some people because it does mean that the virus is spreading more and more widely. But to a certain extent, we've seen this coming. And I think that if we impose these restrictions, if people limit their activities, if they don't gather into large groups, if we do limit ourselves to the essential, I think we can see that the number of cases will be limited, and maybe we can prevent a very tall peak to this second wave. And that, hopefully this won't have to last for too long if we can get things under control fairly quickly.
So you say that this is something we all expected. We knew this was going to happen, but I need to know, why is this happening if we knew that this was a path we were going to go down?
I think it's happening for a couple of reasons. The weather is getting colder, so people are spending more time inside. With the end of summer, people are getting back to their normal routine, so they're interacting more. Everyone's life sort of got back to normal over the course of the summer, which means that they were doing more activities, they were getting together in groups. And as a consequence of that, the virus kept circulating and started to grow. We're seeing more rapid growth now because that's how exponential growth of a biological entity works. So it takes you a certain amount of time to go from 50 to 100 cases. It takes you a certain amount of time to go from 100 to 200. But then it takes you just as much time to go from 200 to 400 and then 400 to 800. So the growth starts off slow and then speeds up very quickly. So because of all these factors playing together, that's why you're seeing this rapid uptake now. This is unfortunately how biological systems tend to behave.
So it seems like it got very intense from Labor Day until now. And it's something like 75% of the cases in the last week. We haven't seen this since May. So how is it that we did manage? I mean, you did explain a little bit of that, but just to know, we undid all of the progress that we made in the last few months. So how is that?
Well, I mean, it's what sort of happens too is that you have to remember that there's a delay between the actions we take today and the results of the tests that we see. So anything that we do today, we're going to see the impact of it maybe 2 to 4 weeks down the road. So everything that's happened now is the consequences of stuff that happened at the end of August. So as people were getting together more, as summer was coming to an end, as people started, coming more and more inside, that's what precipitated the increase of the virus. So it's very hard to establish cause and effect because you say, well, if I do this, what's going to happen? So the government has imposed a number of restrictions. We went from green to yellow and then yellow to orange, now orange to red. And people say, well, why isn't that making a difference? Well, it's because it can take several weeks to see the impact of any of those changes. So the government is responding because it looks like we are in a second wave, that the number of cases is going up, and that better to do a lot now than to wait and let things get under control. And the government has said this a few times, that if we can endure a little bit of sacrifice now, hopefully we can get things under control so that people can celebrate Christmas and get together for the holiday. So it's about, a little bit of effort now is going to prevent a lot of pain in the future. And hopefully, if we can curb the spread of the virus, we can keep the cases manageable, and we won't have the healthcare system being overloaded. We won't have to delay surgeries, and we won't have to make the wait times even longer than they already are. So a lot of this is preemptive. It's a prophylactic measure. Even though the situation is not that bad right now, you don't want to wait for the situation to get very bad, because by then it's too late to prevent it from actually getting worse.
It seems though, like you were saying, at the end of August is what really went wrong, in the sense of that's the reason we're here today. And it looks like the bulk of the new cases are affecting those who are under 40. So is it to say that it's the youth, the younger population, that just sort of went out and got their last party in before the fall season? Is that really what it comes down to?
It's hard to say. Sort of people, people were acting as if the virus had gone away over the course of the summer, but in fact it didn't. We were still getting around 100 new cases per day, and they kept circulating. The numbers still looked relatively good because they were mostly young people who were getting affected. They weren't needing hospitalization. So the numbers overall looked good, but I think that gave people a false sense of complacency. The problem is that as you have more community spread, and it just keeps getting amplified and amplified, then eventually it starts getting into sectors of the population that would otherwise have been spared. And that's why you're starting to see more and more cases in the CHSLDs. So the more community spread you have, even if it's at low levels, it can amplify very quickly, and then you can get infections in institutions like long-term care facilities, like hospitals, like school, for example. So the more community spread there is, the easier it is for new people to get infected. And that's why you see the numbers just keep increasing rapidly, rapidly, rapidly until you can break the chain of transmission, get things to cool down, and hopefully have cases start to go down again.
And is that because, a lot of people, the message was not getting through to them, or was it blatant, disregard for the rules in a sense? What would you say to that account?
Yeah, I think some people weren't taking this virus as seriously as they should have. I think a lot of people were doing things that were not permissible according to the public health guidance, and maybe they didn't think the virus was that big of a deal. People were having large parties, people were having large gatherings, even though that wasn't really what was going to help the situation. But I think a lot of people were just confused, and they said, well, why can't I have a large gathering if I'm allowed to have a large wedding? Why am I allowed to gather here but not there? So I think there was some confusion, and that led people to think that maybe this wasn't as big a deal as it should have been, and that allowed the virus to keep circulating, and it allowed this baseline circulation of the virus to persist throughout the summer, and which is why we're starting to see the amplification of the virus now. So it's very complicated. It's hard to point the finger at any one group or organization, but at the end of the day, we are all in this together, and we all have to change our behavior to a certain extent. So if we can all change our behavior, if we can all limit our social interactions, I think this thing will get better, and we will hopefully prevent this from getting much worse, and hopefully flatten the curve and prevent more and more people getting into hospital and preventing the hospitals from being overwhelmed like many were during the first wave.
Thanks so much, Dr. Labos. I really appreciate it.